Good afternoon, most of you. Good morning for some of you. So,
Bonjour.
bonjour. Nous avons des collègues comme
Hello, we have colleagues like Nadine, Festa, Robier, Pascal. Hello and welcome. And there are so many other people that I don't know yet. Hello, Nadine.
I see some faces that I know. I think I saw Sarah. I think I saw a couple of other people. Welcome, everyone. People are getting in the room. We are at 30 something for the moment. We are waiting for a few more people. I just wanted to invite all of you to have access to the interpretation before we start. So on your screen, on the bottom, you have the little globe, and I'm pretty sure you're used to that now, where you can select interpretation in English for all of us, because we will speak both languages. So please go to the English booth. Et donc, je vais le dire en français. Bonjour à tous, bonjour à toutes, bonjour nos amis francophones.
And now in French, hello to all of our French-speaking friends. We do have an interpretation service today, and you can click on the globe icon at the bottom of your screen in order to choose the language that you would prefer to listen to. You can choose the French language channel for all of our Francophone participants. Has everyone been able to access the interpretation? I want to make sure that everyone has chosen the right channel.
So we can start and have everybody fully comfortable with the conversations we're going to have together. All right? Shall we wait for a few more minutes, or shall we start already with the introduction? What do you think?
Let's wait for one moment.
Très bien.
While everyone connects. Good morning, everybody.
Good morning. Fernanda is the colleague who has organized this webinar with all and the GFF team, and you will see some of the faces in a few minutes, but also with the different countries. We have the pleasure of having Chad, Tanzania, and Rwanda here, so we'll hear from their country experiences. Donc, voilà, j'utilise le français aussi. Donc, je vais passer d'une langue à l'autre, mais pas tout le temps, puisque les interprètes n'aiment pas quand on passe d'une langue à l'autre trop rapidement. Et donc, voilà. Donc, est-ce que tout le monde nous entend?
Can everyone hear us? For those who are going to be speaking, we would ask that you have a headset with a wire. It is much more practical and we'll be able to hear you better. We're going to wait a bit longer and then we'll start in just a minute or so. I know that we have one colleague from Chad who is already here with us, but we are waiting for other colleagues. So we have about 40 people who are already here, which is great. While we're waiting for other participants to join, I would encourage you to use the chat to say hello to everyone and to let us know what country you are connecting from. That way we will know what countries are here. And then we would ask you to rename yourself on Zoom so that we can see what country you are from. Here in the chat, we have Jean Ouattara, who has just said hello to everyone. We have Caleb, who said good afternoon. So we can start with a brief introduction, and I will hand the floor to Dr. Amir Hagos, who is in charge of this team at the GFF. And this is the team that has organized this workshop. So we're at 44, so I will now hand the floor over to Amir.
Thank you, Pascal. Good morning, good afternoon, good evening, everyone. Bonjour. We are very happy to see all faces, and we are very happy to have a meeting, this workshop for the coming 2 hours with all of you to learn about different country experiences of innovation, and also to learn from the success, challenges, opportunity, and also to create some spaces to discuss about what we can do in the future about innovation, and also to a little bit share about GFF perspective and how we are doing for the last few years about innovation and what our thinking in the future. And I hope this 2 hours innovation workshop, it's just a startup to continue our discussion and to follow up implementation and other challenges. I know 2 hours might not be enough to share all the experiences, but just to give a sense that, what's going on at different countries level about innovations that will help us to engage more, to interact more, and also for GFF to work with all of you to make sure that the innovative approach will be implemented at large scale to help mothers, women, adolescents to have a better health in life. And we're looking forward to have all this discussion, and I hope that we'll have nice time and active participation, and also sharing our experience together and to learn from something from that. So since we only have 2 hours, I don't want to take much of time. I'll just share my mic back to Pascal to kick us off with few presentations and discussion. Thank you.
Yes, thank you very much, Amir. Yes, indeed, we have a few more people who have joined. I just wanted to remind you that you can use the interpretation button at the bottom of your screen and select English. Et je le dis en français, pour ceux qui viennent de nous rejoindre, n'hésitez pas à utiliser le bouton
For those who have just joined, please use the button on the bottom to start the interpretation function. Hi, I believe your mic is open. We will take care of that if you could mute it while you are not speaking. So 3 quick things. We're going to start by talking about how the GFF supports these innovations and what the GFF has been doing. Then we will have 3 examples from experiences from different countries. These are very important for us. So it's not just the institutional voice that you will hear, it is also the country voice that you will hear today as well. And we know that that is quite interesting for you. And we're going to talk as well about how the GFF is planning for innovation in the future. And one last thing before we get started, we want to make sure that we can cover as much information as possible. So I encourage you to use the chat to introduce yourself, to continue the conversation, to ask questions. So now I'm going to hand the floor over to our colleague Sneha, who is going to talk about the SDR approach and the support that the GFF can provide in terms of innovation. Sneha, to you.
Thanks, Pascal. So I'm actually going to kick us off with a little bit of an overview, and then Supriya will come in with more on the SDR. But good morning, good afternoon, everyone. Thank you for taking time to join us today. I'm just going to start sharing the slides, which hopefully everyone can see.
Yes, we can.
And we, sorry to interrupt, Jusna, the slides as well are going to be in the chat for the French speakers, translated slides. Thank you.
Thanks, Fernanda. So we wanted to share a little bit about why GFF started really looking at innovation and integrating innovations. And the challenge that we see and that all of the countries are seeing is that the curves are not bending fast enough to reach the SDG 3 targets, and we have to figure out how to accelerate progress. And this has become even more important because of crises like COVID and others, which have highlighted the health system weaknesses and reduced some of the rate of progress and achievements that had already happened in the years before. So the need is to look at continuity of essential health services, especially when systems are under strain in crises and beyond, strengthening service quality, and reimagining service delivery in how to reach the most vulnerable, and overall building more resilient and equitable health systems for the future. So now the opportunity is using innovation to enable countries to achieve these goals. How can we meet the demand from countries on actually selecting, scaling, and sustaining innovations matched to the priorities that they're seeing for women, child, and adolescent health and nutrition? And there are different areas where innovation can make a difference, and you'll hear about it today from some of our other speakers. There are different service delivery models that can change the way that services are delivered, that services are accessed. There are models around the financing for health, the supply chain, different products and technologies. So this is to give you a little bit of an overview of what are the different stages of innovation from a high level. There's the initial stage, which is called the seed stage, where it's really more partner support to innovators, the ones who are coming up with the innovations when it's products and technologies. And here the innovators need the financing to develop and test these, and having a dialogue with government, with partners on what are the needs on the ground and how can their product match that. And there are many partners that work in this space. Then as the innovation starts becoming a little bit more larger and more implementable, we move to the GFF Innovation to Scale initiative, which some of you may be familiar with, which is the transition stage with small amounts of financing that is also channeled through partners, but to both innovators and governments or third parties for pilots. And then what we will talk about today in more detail is the GFF Partnership to Scale, which is taking mature innovations that governments can then, with GFF and partner support, scale up in their health system in a very integrated way, having government ownership be central to the whole process of selection and implementation, and how GFF and partners can provide very targeted technical assistance and financing to support this implementation at scale. And this is what does the different stages of the GFF life cycle of support for innovation look like. It starts in the bottom left corner, where you see country dialogue and prioritization. I think many of you are aware of the GFF country platforms, and integrating innovation into the country platform, into the investment cases, and that policy and financing dialogue is the first step to identifying what could then be done. The next step is moving to matching the challenges that the country has identified to potential innovation solutions. So this involves a landscaping process that actually lays out a menu that government and stakeholders can look at to select from which meets their need the best. And the GFF provides both financing through technical assistance, as well as the convening to help bring everyone together to discuss. And then once the innovations have been selected and match the challenges, we move to the third stage, which is the financing. So looking at more sustainable mechanisms for financing innovation is critical, because we find that when they are funded outside of government systems, sustainability becomes a real challenge, and having visibility and planning ability for the government in how to continue these innovations so that they don't drop off when a grant ends. So therefore, the GFF works with the government to combine implementation grants together with the World Bank financing as one package, both allowing access to a larger volume of financing, but also therefore giving government the full ownership of the funds and the deployment of the funds. Alongside the financing, there's also capacity building elements that come in, which are very critical. And then finally, the last stage is implementation and results, because it would be supporting the implementation through the World Bank projects, and then tracking the results that are coming out of it. And you'll hear from our partner countries today how they've done this for different types of innovations, from delivery models all the way through to data systems and quality of care. This is a snapshot of how different countries have looked at different innovations. I won't go into this in detail because we'll hear more about it soon. But on the left-hand side, you see the different categories for the GFF's innovations that we support. And to very much, again, make the point that innovation can be a broad term, which could be a digital tool or a technology, but it can also be what we call the service delivery redesign, which is new models of care and improving models of care, and improving the design of the health system itself. And so what does success look like for the innovation program? One, it could be more health workers with getting the right training and having the right tools to deliver quality care. It's stronger referral systems to ensure that patients are getting to the appropriate care when they need it, even when there's complications or emergencies. It is also policymakers having access to the right data from the front lines, feeding back upwards for decision making to allow them to make the best use of resources. And finally, all of this would come together to have more integrated delivery and financing reforms for more resilient health systems, which are more sustainable, and providing quality care for all women, children, and adolescents. So I'll stop there. Thank you very much.
Thank you very much, Sneha. If we were in a real setting with people in the room, we would have clapped. But of course, we are in a virtual setting, so we can use the little reaction button. So I just encourage you to use it as much as possible. Thank you very much, Sneha. Before we start, I just wanted to say, maybe you can introduce yourself and say a few words about you, and then we can start asking if there are questions about your presentation. A few words about you, Sneha, please.
Sorry, I should have done that in the beginning, everyone.
My fault.
I'm Dr. Sneha Kanniganti. I lead private sector engagement at the GFF Secretariat based here in Washington, D.C.
Thank you very much. So that's the first step of our reflection today. We wanted to explain a little bit about how the GFF sees and approaches innovation and the kind of support the GFF provides. That's the first step. So are there any questions? We have a few minutes for questions of clarification to make sure that we all understand how the GFF perceives innovation. Are there questions you have burning questions at the moment? I know some of you are looking at the French version. I'll give you a few minutes to think. If you have any questions, I've noted some elements that could be interesting to explore, but really up to you. You can use the chat also throughout the conversations if you want to send questions, and my colleagues would be more than happy to answer. Just a few minutes just to clarify. No questions at this stage. Okay, no problem at all. We can continue, because what is really interesting is also to contrast what you've presented with real life, with country experiences. So it's going to be very interesting to do so. The first presentation, I'm going to switch into French. La première présentation devait être...
The first presentation was supposed to be Chad, but I am not sure that... well, before Chad, we actually have one presentation that's very important regarding the SDR, which is the reorganization or the SDR system system delivery redesign. Subria, you wanted to tell us about that, about innovation. Could you introduce yourself?
Yeah, good morning, everyone. I'm Supriya Madhavan. I'm a senior health specialist with the GFF Secretariat, and I lead the Secretariat's work on service delivery redesign, which I'd like to spend a few minutes talking about this morning.
Supriya, would you like to share the presentation, put the presentation in presentation mode?
I thought I had. I'm sorry.
Yes.
Can you confirm?
Yeah?
Yes.
Okay. Now you have.
Sure. Thanks. So as Sneha said, this is not so much an innovation that has to do with a digital tool or any kind of a gadget, but it really has to do with higher level, a macro level health systems reform as an innovation. So service delivery redesign was first kind of the term was brought up when the 2018 Lancet Global Health Commission report came out, which really looked at the topic of quality and health systems quality. And the Lancet Commission sort of pointed out that we can actually save as many as 8 million lives a year in lower and middle income countries if we just had high quality health systems. and that really quality impacts, the impacts of poor quality are most acutely felt amongst the poor and disadvantaged populations of the world. So really what the Lancet Global Health Commission called for was the idea that we would need sort of system-wide action to improve quality. So given that, I think that the GFF was also sort of inspired to get to lead the charge with the World Bank on this area of service delivery redesign. So what was the main motivation for the GFF to get involved in SDR? It's really this idea that, so now that we're in 2023, much of the world, even in our GFF countries, have really done a good job in increasing the number of women who go to deliver their babies in formal institutions. So to have facility deliveries with skilled birth attendants. But what we've seen is, and you'll see the graph on the left shows that for countries where they've met their SDG targets on skilled birth attendants, you still have high rates of newborn mortality. And you see a similar picture on the right in terms of maternal mortality. So even though we've done a great job in moving women into facilities for childbirth, rates of mortality have now really stagnated. So we turn to the issue of systems quality as a result. So what the Lancet Health Commission said was that they posited this sort of theory of change on the right and identified that redesign of service delivery is one of the 4 sort of big buys and universal actions and really disruptive actions that health systems can take, including governing for quality, looking at transforming the health workforce, and doing a lot of demand side work to ignite demand for quality from the population. But this 4th action of redesigning service delivery came out as sort of a key game changer for quality in lower and middle income countries. So what is SDR? Service delivery redesign is the intentional reorganization. So the stress is intentional reorganization of a health system to improve quality and outcomes. And for us at the GFF, we really care about outcomes for women and newborns. So this means that reorganization can include where services are delivered, when services are delivered, and by whom. So specifically for maternal and newborn health services, SDR really ends up meaning that all women have access to comprehensive emergency obstetric and newborn care services within 30 minutes of place of birth. So this is really important. This is a statement. We're saying that if a woman gets into trouble during childbirth, wherever she's delivering, if it's at that primary healthcare facility, if it's at her midwife's health facility, or at home, she needs to be able to get to a facility of higher level care, of definitive CMONC care, within 30 minutes to have a really good chance of saving her own life and saving her baby's life. So we stress that this is an aspirational statement. We know that many of our countries in the GFF will not be able to achieve this in the next 3 to 5 years, but we really see this as sort of a vision that the countries should be aiming for, as sort of a vision of the health system that you would like to have, to ensure that all women, not just urban women, not just rich women, have access to high quality CMONC services at the end of this service delivery reform. Sorry, I'm just Right. So what we found from working with countries on SDR is that it's really a process. We're not saying there's any one model of care, but we want to stress that the process itself is very beneficial to for governments and stakeholders to understand what women want, what community wants, and how the system can be responsive to them. So the process includes 5 stages. So the first, of course, is the engagement that is completely government-led. It's sort of an understanding of what the problems are in most GFF countries. It's squarely focused on how do we improve health outcomes for women and babies. So identifying the theory of change and trying to see what the financing resources might be. We would then move into a stage of formative research where we take a deep dive look at doing primary data collection and with respect to health systems quality, health facility quality, talking to women and communities to figure out what their barriers are, what their preferences are, and doing a whole lot of other secondary data analysis to really understand the current state of the health system. And then we take all that data, move into step 3, which is participatory design. So using a human-centered design approach with a large array of stakeholders to come out with sort of a prototype and options for a redesigned system. We would then take the option that is converged upon and move into implementation phase and do a lot of implementation research around that, and eventually also try to evaluate such a redesigned system. So this is not a process that takes place overnight or even within 2 or 3 years, but we really see this as long-term macro level systems change. And we'd like to offer that the GFF and the World Bank can provide technical assistance to countries who would like to explore this kind of an innovative approach to improving quality. And we would also help, of course, link with the World Bank opportunistically to see if there are projects and loans that can be exploited to support governments in exploring SDR. But we're in early stages. We have a number of engagements globally, probably in about 12 or so countries. And we're getting more and more demand from countries every week, it seems. So this is just one example of a systems level innovation, and we would be happy to work with you all on this. Thank you very much.
Thank you very much. I see a few questions in the chat, and you can imagine that yes, thank you. I see some questions in the chat, and I think there's one that I think is interesting. Is Faustin asking from DRC. He is asking, why does the health system reorganization, SDR reorganization, only include the why, the when, and the whom questions, and does not include the how question, which is very relevant to SDR. Supriya or Sneha, would you like to share this reflection on the 3 or 4 or 5 W's?
Yeah, sure. Bonjour, Faustin. So it's a great question, and implicitly we're saying that we're addressing the how as well. But I think the big issues are really looking at when we talk about childbirth, we really want to look at where the delivery services are happening, because we want to ensure that a woman is able to get to emergency obstetric care when she needs it. And that's the when. And then by whom is we really need qualified personnel, both at primary healthcare level as well as at hospital level, to ensure that the services are delivered. The process of SDR, the process is really about the how. So working with all the stakeholders, particularly, government stakeholders, to figure out, how the system can be reorganized. And there are a lot of pieces that need to be reorganized. So human resources for health, commodities support, health financing, of course, all the building blocks are implicated. So that is the how, Faustin, but it's an excellent question. I'll note it for my next presentation.
Thank you. We have a question from Tideke in Ethiopia who says, does the SDR consider other contextual factors like availability of water, electricity, access to road, which are critical to service quality?
Yeah, this is Sadeke, this is a great point. And again, if I had more than 5 minutes to present, it should be considered as sort of a multi-sectoral approach. We do have settings whereby we're talking to other arms of the World Bank who are working on roads, who are working on WASH and healthcare facilities, who are working with the transportation department of the World Bank. So that's an excellent question. We really expect over time, we see that as roads improve also that communities will be making different choices based on different aspects of access. Absolutely.
Thank you very much. There's a question on the criteria to identify innovation. I don't know if Sneha's mic is working again. If not, maybe, I don't know, Amir or Supriya, would you like to say a little bit about the criteria that you've identified to identify what we can call an innovation?
Maybe I'll give that one to Sneha.
To Sneha, if she's here. I know she has a problem with the mic. She told me that she has.
Okay.
So maybe she still has a problem with the mic. Okay. Anyone would like to
I
give it a
just
try?
think I know generally what we've been discussing in terms of innovations criteria is to map out what the needs are first and to make sure that the innovation corresponds to the needs. And that again comes back to prioritization. I think countries have a great number of needs, but you identify the top needs and then see if there's an innovation that might help accelerate the response for those needs. But it's not that we come with an acceleration with an innovation to a country setting and say, can you use this? Because if you come with an innovation, as we say in English, we have a saying that when you have a hammer, everything becomes a nail. So we don't want to do that. We want to flip it and say, in your investment cases, what have you prioritized as the primary needs? And do we have a way to accelerate the responses and the reforms to respond to those needs, that can be aided through some kind of innovation. So
Thank you.
for
Yes.
the SDR example, we've had countries coming to us who literally say, look, we still have a great many number of women and newborns dying in childbirth. And we've increased our making sure that more deliveries happen in facilities. So how do we improve quality? And then we start talking to them about aspects of equity and access and the right time, right place. I see Sneha's back on the screen.
I don't know if her mic is acting out.
It's a little better now, Pascal,
Okay.
I think.
I think so, yes.
I did also put my response in the chat because I think Supriya laid it out well. If you also look at the slides that we shared in the beginning, it all starts from the problem identification. And that includes looking at why is what we're doing now not working or not working fast enough to get to results. And so doing anything differently, whether it's reorganizing your care model, whether it's bringing in a product or technology, is all then meant to create a shift. And that's at the, I think at the highest level, how we look at innovation for the GFF. And so it's not coming in with a predetermined menu, because what might be a suitable menu in one country may not be in the next, even if they're trying to address the exact same problem around, let's say, health worker training. So I think the context specificity and having the challenges identified and agreed on is really critical to then move to matching what are possible solutions, because sometimes there may be a need for more than one. And I think I saw Daniel also had his hand up. I'm not sure, Daniel, if you wanted to add to it.
Yeah, thank you, Sneha.
Daniel, would you like to open your camera and maybe introduce yourself?
Okay, yes, there.
You can see you now.
Yeah, I just wanted to add to what Sneha and Supriya have said. Part of this also stems from the fact that at the GFF, we have a normal data cycle and we collect data, and some of these can actually be obtained. We can look at some of the challenges that are emerging from the data that we collect each and every year and identify some of the issues that are arising that can be subject to innovation. So we can actually start from there. Thank you.
Thank you very much, Daniel. So there's a couple of questions in the chat. I think there's one from Nadine. I will switch to French so I can say it in French. And alors, Nadine pose la question de comment évaluer.
Nadine wanted to know, how do you assess the time needed to develop and implement SDR? If we're looking at an emergency situation, for example, reducing maternal and child mortality, how can we choose, or how can we apply this solution, particularly in fragile countries? We have questions as well about if we are putting an if we are emphasizing the importance of primary health care and we're looking at slightly fragile zones, what can we do? Supriya?
So I think those are great questions. So Madame Nadine, bonjour, comment ça va? So you know, Nadine, I've worked in Burkina Faso, I've worked in Mali, and now we're actually we're planning a pilot of SDR in DRC. And so we would like to be able to test that SDR is not just works in middle-income countries, but that it also works in fragile settings like DRC, Chad, Niger. We have planned for the next few years. So the time to implement SDR, like I said, it's not something that can happen just in 1 or 2 years. It's a whole of systems reform. It really takes a lot of time to move all the pieces. But we do know at very high levels of mortality, like you see in Chad or DRC, they're well before redesign. We know that there are some very cost-effective interventions that we should still be pushing, even in the SDR stage, but like family planning. We know that that's the most cost-effective form of maternal mortality reduction. So that still should be prioritized. In the meantime, we would look to pilot first to make sure we have all the elements of redesign correct, evaluate the redesign pilot, and then see how we can go to scale. But it is to be said that we don't have too many examples of this in FCV settings. So I think both the World Bank and the GFF are committed to showing that this can work in other settings as well.
Très, très bien, merci. J'en profite pour lire un commentaire de Jean-Bertin et Pumba.
Thank you very much. I just wanted to add what we heard from Jean-Bertin Epumba from the DRC. He said, thank you to everyone for the support. And the DRC is currently working on developing its strategic national plan to improve quality of care. The financial and technical assistance of the GFF is very welcome in this work. So looking at primary healthcare,
do this in areas with low accessibility? How do we transport women? Supriya, do you have a couple of comments on these elements?
So I can't stress enough the importance of improving the quality of primary healthcare as we strengthen hospital care. We still have a long way to go to improve the quality of antenatal care, postnatal care, nutrition counseling, family planning, and those aspects of primary care that are still very, very important to the health of the mother and baby. I think what we're saying is we have to still ensure, when we've looked at efforts to improve primary care in the past, while lots of outcomes have improved at primary care level and processes of care have improved, we still have not seen higher level outcomes like mortality reduce because of this reason of access to definitive care and access to emergency services. So that's what I want to stress. We are not saying that the quality of primary care is not important. It is very important. But at this point, to reduce mortality further, we need to have that link to emergency services.
Thank you very much. I think that's a little bit important. I think Caleb is asking, do GFF work with countries at national level or even at a specific organization partner level? I don't know if it's clear for you, or should I ask Caleb to explain a little bit more? Caleb, would you like to, maybe Caleb, if you want, you can take the floor. We have a couple of minutes, so maybe you can take the floor. It would be always, it's always nice to hear some voices, or not only our colleagues speaking. Caleb, would you like to dare to be the first one to ask a question live?
Yeah, right. Yeah, thank you.
Thank you.
Yeah.
Which country are you from?
Yeah, I was asking that if GFF work with organizations directly, or is through countries, the country programs, or countries directly, government institutions.
Okay.
Yeah.
Snea, any? Or Amir, maybe Amir, I see you're opening your mic.
Yeah, thank you, Pascal. Thank you, Caleb. GFF, our main partner is government. We are always working through government system by putting government as a leadership position to help government to prioritize and bringing high effective intervention to improve maternal, child, and adolescent health. But at the same time, we will also support government to align with all partners at the country level, including private sectors and civil societies. So our major partners are government, but we also work with country level stakeholders, including donors, partners, civil society, and private sectors.
Thank you very much, Amir. Okay, we've been talking theoretically, and I think it's very interesting to understand the framework, the logic behind the approach of the GFF. But let's move to maybe hearing some country voices. I think it could be very enriching for all of us to do this. So let me give the floor to our colleagues, to our guests from Tanzania. If you want to open your cameras, we have Dr. Maria Mongara. I think you are. We cannot see you, but I see your camera is on. And we also have Agnes Magaya. I don't know if your camera is on. I see you. Yes. Good afternoon, Agnes. And I don't know if Mariam can hear us. Yes, Agnes, can you hear us?
Yes, I can hear you.
Excellent. I know we have a little problem with your camera, but I think we can hear you well, but I don't hear Mariam. Ah, yes, you have two screens. Mariam.
Yes, I can hear you.
Yes, excellent. Thank you. So make sure we have the capacity to hear you well with your headsets. So would you like to share your presentations? We're going to hear your examples of the Tanzania mountain model approach. Which of you is going to open the camera or open the presentations? Mariam, are you the first one to speak? Or is it
Agnes? Can you please? Yes.
Okay.
Agnes is opening. So Mariam, maybe are you the one who is going to speak? To present?
Yes, please.
Please go ahead. Maybe say a few words about yourself before we start.
Yeah.
You have 15 minutes to present the project that you'd like to share with us. innovation landscape assessment in Tanzania.
Thank you very much. Good morning and good afternoon, everybody.
Everybody's saying good morning, good afternoon. You cannot hear us.
Hello.
Yes, we can hear you very well, Mariam. Please go ahead. Agnes, can you put in a presentation
Thank you very
mode,
much.
please?
So I'm Mariam Ongara. I was the consultant, a local consultant for results for development and insight health advisors in the work that in the program we did in Tanzania last year, that is enhancing public sector demand for and scaling of health innovations. Thank you. So to start with, first slide, please, Agnes. Hello.
Agnes, you're on slide 5. So if you want to go back a little bit. Yes, a bit again, back until the first slide.
Yes, so we did innovation landscape assessment in Tanzania, and the objective.
Sorry.
Objectives of the assessment. Yeah. So the objectives of the assessment was the overall objective to identify innovation that can be scaled to meet the needs and priorities outlined in the Tanzania Development Vision 2025, the Health Sector Strategic Plan 5 of 2021-2026, and One Plan 3 of 2022-6. So that is the overall objective. And this, we had a specific objective to develop in consultation with the Minister of Health, that the current gaps and bottlenecks in prioritize reproductive, maternal, newborn, and child health outcomes. And the second one, to examine the innovation landscape in Tanzania, to identify existing proven systems and innovations in use. And the third one was to support the institutionalization of innovations by providing technical assistance to the government of Tanzania, and to assess capacity, structural arrangement, and existing system bottlenecks of Ministry of Health in prioritizing and scaling up of proven innovations. So the challenge on innovations is to link innovation with the supply, with government demand. So to address the challenges, all these barriers, so that to scale up innovation, there is a need to forge new collaborations within the health and development innovation ecosystem and align different partners, individuals, and contribution to optimize outcomes, and link the supply of innovations, particularly those that are validated or de-risked for transitioning to scale with demand from countries. Next, please. So the response to those challenges, or to all the challenges mentioned, is that the GFF, the Global Facility Financing, through the World Bank, through Results for Development, and Insight Health Advisors, explored on how can innovation funders facilitate increased public sector demand for and scaling of health innovations. So the program in Tanzania, which we did in Tanzania, of enhancing public sector demand for and scaling of health innovation, we have two phases. The design. The first phase we did from July to in-depth literature review and context analysis. And we did also key informant interviews with local and international stakeholders. And out of these, from the phase 1, we generated reports. The reports on the enhancing public sector demand for and scaling of health innovation in Tanzania, understanding supply side opportunities and policy priorities, demand and potential innovation matches. So those are the reports which were generated through phase 1 implementation. Phase 2, what we did is to design and to co-creation, whereby we did from September to November 2022, we co-design of a locally led mountain model to enhance innovation, demand, and scaling. And this co-design was done by the national and the regional cohort members, proposed from Tanzania, where they proposed Tanzania proposed mountain model and action plan. And the cohort presented their recommended approach to the senior government of Tanzania leadership for consideration. So we started with the landscape assessment methodology. We had a goal, 2 goals, that the landscape assessment was to, landscape assessment goals, landscape relevant policy frameworks and empirical barriers influencing RMNCH innovation within the Tanzania health system. And the second goal was to understand supply side opportunities in RMNCH innovations. And we had 4 steps to do the landscape assessment. The first one was literature review. We did the in-depth literature review. We reviewed policy frameworks from national level, regional level, and international level. And then we did the key informant interviews and stakeholders from national level, regional level, council level to community level as well, and other partners. And we did data analysis, synthesis, and draft report. And the fourth one we validated, we did validation of findings and final reporting. So the findings from factors influencing demand for and scale up of health innovation, we deep dived into 6 factors. Factor number 1 was articulation of demand. The other factor was incentive to look for innovations. And the third one was awareness of potential innovations. And the fourth one, ability to engage effectively with innovations and innovators, and political will to fund scale up rules, regulation, and procedures. So these factors, the 6 mentioned factors, they interact with each other and they influence each other. So our findings. Hello.
Mariam, can you hear me? Yes, I just wanted to tell you, you have 5 more minutes. So I know you have plenty of findings. Would you like to select a few and not go through the whole list if that's okay with you for the next slides? Thank you.
Okay, thank you very much. So on our findings, for example, challenges on public sector articulation of demand, we had seen that the findings were that challenges and barriers is there was no guideline within the ministry, within the health sector for sourcing, adoption, and scaling of innovations. And we found also some partners, innovation focused, reproductive and child health innovation only in one intervention without supporting other components. And another one is inadequate awareness on potential innovations available among public sector. So we had really, our reports narrates a lot of challenges and potential solutions that came out of the findings. Inadequate coordination of RMNCH innovation and innovators, gap between budgeting and actual allocation. And yeah, so those are just examples of the findings. So we went on findings on policy, RMNCH policy priorities and potential, matching health innovation. We had areas, priority areas from the policy framework, like maternal health, child health, adolescent health, where we have matched innovations which can be suited for maternal health and for child health. For those areas. So now after that, may I, my colleague may I invite now my colleague to continue with the mountain model.
Dr. Mariam, you can continue because of the time.
Okay, thank you very much. So the mountain model process, the mountain model is a frame of reference designed to help a government-led demand-driven process. And rather, it doesn't prescribe activities in advance, but it builds around continuous process of contextual co-creation. And there is no set framework, sequencing, or metric of success driving the progression. So for the proposed Tanzania public sector scaling, we had, next please, we had 4 steps. The 4 steps included, demand articulation, matching demand and innovation, adoption of and scaling, and institutionalization and meal. Next slide, please. So this is the proposed mountain model for Tanzania. The Kenya mountain model had 6 steps, but for us, we just proposed 4 steps on mountain model. We merged step 2, step 3, and step 4 of the original mountain model.
Dr. Yes, I was just going to ask Agnes to show the stages. Thank you. Now we can see the four stages. Yes.
Yeah, this is the 4 stages. As I said before, that it was adopted from Kenya, but the Kenyan mountain model, it has 6 stages. For Tanzania, we proposed 4 stages. We merged stage 2, stage 3, and stage 4. And the stages, actually stage 1 is a process, and stakeholders engage and consultation, and they prioritize and which is matching demand with innovation for alignment with priorities, they track it, resources and funding models. And stage 4, which is adoption and scaling.
I think we lost Dr. Mariam. I think we lost you on the last.
Procurement agreed scaling pathway.
Sorry, we lost you on the last stage, on the institutionalization. I think we're
institutionalization
losing.
And MEL.
Yes. And what is MEL or meal? Sorry, I'm asking you.
The mountain model.
What is MEL or meal? I'm not sure to know the acronym.
Okay. MEL is monitoring, evaluation,
Okay.
learning, and adoption.
Okay, thank you very much. Sorry, we didn't understand everything, but I think we got the gist of what you were saying with the process. All right.
Yeah.
Thank you very much. Thank you. It was so we have the next steps. Yes, please go ahead. Share the next steps.
Yeah, the next steps is to set up an interim steering committee to implement the recommended and the action plan. As I said before, that the cohort members, they developed the action plan as we wait for the establishment of the formal structures. It means the Minister of Health, President's Office, Regional Administration and Local Government, and the regional champion members will participate as interim steering committee members. And to develop terms of it for the lines for prioritizing and assessing innovations, and build the capacity for the identified and appointed focal persons, steering committee, and innovation teams, map partners, and identify available priority innovations in various areas of health and innovators to collaborate with. And the other step is to encourage transparency between innovators and organizations so as to encourage co-creation. And the last one is to test, and as I said, it has 4 steps in 1 to 2 regions in Tanzania, including Dar es Salaam region where we did this work. So thank you very much.
Thank you very much, Dr. Mariam. I have one question of clarification. Why do you call it mountain model? Dr. Mariam, did you hear my question?
We call it.
Yes, mountain.
Yes, I heard your question. It is a mountain model because it goes from step 1, step by step, as climbing a mountain.
Excellent.
Thank
you very much. Because I was wondering,
as you can see it from
the previous slide, because I was imagining translating the word into French, and I was a bit curious. So thank you very much. We can send little claps for your presentation. Thank you very much. We will have some questions a bit later, but maybe we can immediately go to the next presentation with Rwanda. Let me check if our colleagues from Rwanda are here. And I'm going to give the floor, I think we're there, to Gilbert Munyema and Alain Placide and Sabimana. Alain, thank you, Dr. Mariam. Alain, are you here? Alain is sharing. Alain is sharing, and my colleague Fernanda is also putting the French versions in the document. And I just, je vais juste vous rappeler que l'interprétation est disponible pour les francophones et ma collègue Fernanda met le document.
Just a reminder that French interpretation is available for our French speakers.
Presentation, but we cannot see you.
Yes. Hi,
everyone. Here you are.
Yeah.
Thank you.
Yeah. Thank you, Pascal.
Go ahead. You have 15 minutes. You too.
Yeah. Thank you so much. My name is Alain Placide Sabimana, working for GFF, seconded at the Rwanda National Child Development Agency. I want to take you through the innovation of the NCDA, the Rwanda Child Development Agency, which is in terms of concern the data systems. It is called the Rwanda Integrated Child Development Dashboard. At the background of our innovation was that based on the experience during early childhood, marked the development of the brain, ability, skills, attitude, and emotion and behaviors. And the government of Rwanda is committed to promoting ECD policies, investment aimed at programs related to ECD. ECD stands for Early Child Development, including nutrition, health, hygiene, early stimulation, and early learning. The RCD dashboard supports regular monitoring of priority indicators from the result framework of the National Child Development Agency operational plan implemented at the multi-sectoral level. And this is the GFF investment case for Rwanda. And it is also monitored at the country platforms, including the technical working groups, the subclusters, among others. The challenges that were addressed, first, there was the fragmented information systems that were based on different sectors, mainly the health, education, social protection, child protection, civil registration, and food safety. All these are scattered across a number of government institutions. There was issues also, some data that were not collected, mainly the different indicators for ECD. We also had innovative tools that were emerging, and this was creating new opportunities as well as the need for alignment and harmonization. This we can mention the Child Scorecard, which is a tool that combines a number of 22 interventions that are a child below 2 years should receive. There was also community health workers, an intervention for home visitation for children below 3 years. That also was part of the new innovation that were there. There was the ECD scorecard. This is a perspective survey that collects satisfactory survey that was conducted to show how the beneficiaries, the community perceive the interventions provided to in terms of the ECD. There was also the DPM scorecard. This stands for the District Plan for Elimination of Malnutrition. There is also a number of data tracked by this tool. There's also the ECD Center monthly reporting tool. This is a tool that collects data from ECD level. All these were scattered across different levels, and there was a need to see how they can be put together, and so for easy access and for decision makers to have to make informed decisions. You can see from this diagram those different information systems, the Ministry of Health, Mineduc, the local government, and also a number of institutions, and in between there was the former national Early Childhood Development Program, the current National Child Development Agency, which was implementing the multi-sectoral coordination with no information system, but with specific data needs, and also with limited tech capacities. So all these formed a challenge that we had, and we were facing, and there was a need to have something really to solve that issue. The scope was to create a data hub that could consolidate data on those different program areas from different information systems across these sectors to enable easy access to data and provide tailored data, analytics, and of course, visualization for decision makers. The expected outcomes include the improved data access, data analytics and visualization, and also with the main goal to use data and also to improve the quality. This is a logic framework where we see a number of output, input and output and outcome indicators from all this number of programs: the nutrition and maternal health, nutrition and child health, the ECD, the WASH, and child right and protection. The process that it took, there was stakeholders consultation, social cluster ministries and the agencies. For us, we have around 16 social cluster institutions and the agencies. When we say agencies, they are those institutions that are affiliated to ministries. We also had the Rwanda Information Society, which is the regulator for any information system and IT thing, so that they can advise to the, according to the national policy in this matter. There was also the World Bank and GFF and the key development partners. The selection and the design of the process, of course, I was saying there was a consultation, there was also the operation plan, result framework. As I can recall, this is the investment case for the Rwanda, and the indicator mapping. Also, there was a need to assess all the existing data systems, so to avoid duplication of any system, so that if any data is collected in a given specific a given system, so then we can use the integration rather than creating a parallel system. There was also the project phasing as per the NCD data needs and the indicator availability. We used to have some indicators that were available in those systems, and also those indicators that needed to be collected from scratch.
Alain, may I tell you that you have 5 more minutes, if that's okay with you?
Yeah, yes, please. Thank you so much. The GFF role in this project, there was the GFF value add was in providing catalytic support and promoting alignment in collaboration with other partners, and also promoting harmonization and interoperability of information systems and tools. This is the structure, the architecture of the system. You can see the source systems, and also where there is, and we use the integration using API for those who can understand the connection of the system. This is a model of connecting systems, so live data can be accessed in the new system. There was also another way of taking data using Excel files from those systems, then they can be uploaded in the new system. For the system, then data they can be processed and analyzed for later visualization for as per the user needs. As of currently, our system, the ICD dashboard, has over 200 data elements for different program areas. As you can see, more than 100 priority indicators as reflecting the result framework of the operational plan. And also one of the achievements was the integration. So being able to connect to the other sector system, and this is still ongoing. We are planning to connect and for more, so that the data can be really accessed in real time. This is a screenshot from the system. You can see a number of those program areas. We are also one of the output, the data object we have. There is what we call the performance scorecard, where you can flag a number of priority indicators from national and up to the district level. Then the traffic light can be marked, the green, yellow, and the red as per the performance of that specific entity. The outcomes so far, Our innovation is in the process and it has started. It is maturing. I can say that it is enabling a stronger and sustained focus on national priorities by leadership and related ministries through regular tracking of performance indicators. There was also, we noted the awareness of these national priorities in data that has been progressively improving to timely access, which was our main goal through data analytics and visualization, of course, produced by the system. The quality of the data has been improved. So far, we are observing a number of really positive outcomes. And also, we are looking at establishing more platforms specifically for health, where nutrition stands. This is the GFF and the Rwanda Biomedical Center, so that a platform for data use can be established to enforce the strong culture of data use. These are the screenshots for the system. You can see from the system, you can see the data trends. And you can also see from this, the second one, we can be able to see the the status, each of the subnational level. We have also created a public landing page for users who do not have user credentials, so that selected indicators can be easily accessed, and so that there is no need really to make the data requests as it used to be, people writing letters, official letters, requesting for data. There was also some lesson learned, where I can mention the multi-sector level information systems, where it requires extensive stakeholder engagement, which can be time-consuming, but foster buy-in and sustainability. There was also strong leadership endorsement. We noted that strong leadership endorsement is critical in creating momentum and promoting shared commitment. I can see that, yes, I can highlight a few things on the next steps that we are looking at, tailoring the dashboard according to the user need, incorporating more scorecard to track the national plans, among others, and also to roll out a strong campaign of data use promotion at national and subnational levels, because a system that is not used is idle. Yeah, thank you so much.
Thank you very much. I was trying to put the clap. Yes, I did put the clap. Thank you very much. I think, yeah, it was extremely interesting. Thank you very much. You can close your presentation. We have a question on Chad. We'll talk on Tanzania. It will come back in a minute. As I said, if you have any questions, please drop them in the chat. And if you have questions, we'll have a time for questions and answer before in a few minutes. I'd like to give the floor to Alain, who is going to tell us a little bit about the case of Chad. Would you like, Alain, would you be available? Okay. Alain. Not Alain Placide, another Alain. Alain, are you here? If you are, you're muted. No, pas de Alain. No, I see some faces, but I don't see Alain. No? Okay.
Do you mean Karibwami?
No, the Alain from the GFF.
Yeah.
Ah.
For
yes.
Chad?
For Chad, yes. Oui, for Chad.
It's someone from the minister. The minister
okay.
Health, not me.
Okay, sorry. And the person is? Who should be taking the floor? I don't have the name of the person. What's going on with my...
Hi, Pascal. I think Alain.
Daniel. Hi, yes, Alain. Go ahead.
Alan should be able to, I think there is Mobe. Is Mobe in, I think Mobe should be online. If the Secretary General is not in. Mobe, can you do the presentation, please? Mobe?
Bonjour Mobe. Est-ce que toi, tu as la présentation? Je sais que la personne qui devait présenter...
Mommy, do you have the presentation? I think that the Secretary General was supposed to do it, but he was not available. Could you actually do the chat presentation on the health innovation, or you hadn't? Can you actually hear us, Morbe? It's difficult to reach chat today, apparently. No? So, if you don't mind, I'm going to let my colleagues see if they can actually contact chat and see if we can have the presentation, since the General Secretary was supposed to be here, but he's not here. So we'll see if somebody else can actually present that. But there was already a question for Tanzania. So we are going to just talk about that.
Hi, Pascal.
Pascal, yes, Danielle.
Hi, Pascal. I think I can do the presentation because I have it.
Okay, so let's, because it's nice if we have all three presentations in one go, right? So Danielle, please go ahead. Do you have the presentation?
Can you hear me well?
Yes, we can hear you very well. We cannot see you, but we can hear you.
You cannot see me?
Yes, now we can see you. Yes,
all
we
right.
can see you. Perfect.
Let me try and share my screen.
Yes, please. And we're going to talk, we're going to talk about the identification of innovation opportunity on health and the development of a strategy on health on innovation in Chad. And we apologize that the Secretary General could not join, unfortunately. And please go ahead, everyone. Please put your questions or your comments or your examples, your country examples in the chat. We will have some time to have some questions. And thank you, Jean-Bertin, for your first question. It's always, yes, go ahead, please.
You can see my slide?
We can see your slide. Everything is fine. Please go ahead. You have 15 minutes.
Thank you very much. My name is Daniel Ochieng. I'm actually the digital health specialist at the GFF, and also working also in innovation. And I'm doing this on behalf of Chad. The Secretary General was supposed to present this, but unfortunately, maybe he's not able to connect. So unlike the two presentations that you have witnessed, the two presentations that have just been done, this one on Chad, we're going to focus on what the preparations that are actually being done towards innovation. And I must also indicate that innovation doesn't have to be a physical product. It can actually be some ideas to try and see how we can change service delivery towards achieving more efficiency. So if you can look at this, you see that the goal here is to improve the utilization and quality of service delivery of essential RMNSCH plus N services to the people of Chad by looking at how we can improve the routine use of data. Secondly, leveraging on digital tools and technology and solutions, building human capital, that is human resource, to reduce vulnerability and ensuring sustainability of service delivery. So, as I said, this is already this is a plan in action, and we expect that we're going to have a diagnostic report on the ecosystem of digital health, with a specific focus on digital health and data system building blocks. Secondly, through a landscape assessment, look at feasible innovations, those which are already in place, or those which can actually be designed, and then can be implemented and scaled. And in this particular case, for example, you can use to supervise community health workers and also to improve in-service training of health workers. And also a roadmap on development of a comprehensive digital health strategy for the government of Chad. I'll explain how that comes in. GFF has been involved in this project through funding. And specifically the funding, the catalytic funding is intended to enhance the development of a community health worker tool, do a landscape assessment of innovations, those which are existing or these which have potential to be in place, and develop a digital health strategy. Now, Chad has got some challenges, but from an innovation point, we look at those as opportunities. The Chad's digital economy is still at its infancy. And as the country seeks to reinforce and improve its preparedness towards digital transformation, this becomes a great opportunity. There are several digital sector experiences which are still, in a manner of speaking, having some gaps. For example, access to quality digital connectivity, use of digital services, and even digital literacy. In addition, the last mile digital infrastructure in Chad, even though present, is not spatially distributed to help realize the potential of the other regions within Chad. We still have, again, challenges of resource and the need to coordinate partners so that there is an opportunity for these partners to work together and to help in implementing and scale many of the strategies that could be in place. There are also challenges of facing Chad's community health strategy. There's low activity and poor quality of community health services, and of course, lack of reliable community health data. You know, community health is very important, and data from our community is useful in planning and also in realizing some of the important outcomes, especially in RMNS-CAH. In addition, there's poor connectivity for mobile, there's unreliable electricity, and this, as I'm saying, are not unique to Chad. This is actually commonplace to many places. And there's, of course, a need to have more resources geared towards the different regions, especially those which are in the fragile areas within Chad. Now, Chad has invested a lot of strategic effort towards realizing or building a strong foundation for a wide and effective community health workforce. And we believe that strategies associated with community health workforce and its integration will help the facilities provide a strong structure for even better implementation and ensure that any systems which are deployed, for example, digital systems, are not only implemented at the central level, but also at the district levels throughout the country. There's been digitization of HMIS, Health Management Information System, specifically DHIS2, but it's still in pilot phase. And there is still situations where there is manual data collection and even manual reporting in different levels of health systems within Chad. There are several partners who have supported initiatives with digital components, including extending DHIS2 to the different subnational levels. So during an assessment of what is in place, some of the recommendations was to reduce the fragmentation of partners, that is, align them towards not only having their efforts being aligned together, and but also their resources, especially towards community health workers, programs and data reporting, and give or create a central level coordination and governance platform. Secondly, increase quantity and quality of services provided at community level by the existing national cadre of community health workers through training, peer supervision, and digitization of supervision tools. There's also need to have improved accuracy and transparency of community health workforce, community health information at all levels through deployment of digital supervision tools. Now, some of the recommendations which have come from the landscape assessment is, for example, important as a building block to have a digital health strategy and a long-term plan to operate, maintain, and support digital health systems to ensure that they actually address some of the issues that we have noted. This process has started, supported by GFF, and a concept note was already developed and shared, and feedback is being obtained as we speak. The response was because the digital health strategy was there before, this time ran out. And it's important to have policies which are aligned, especially for funding and implementation of any digital health implementation.
You have 2 more minutes, Daniel, if it's okay with you.
Don't worry, I'll be done by that time. There's another need to develop policies to align and govern approach to digital health strategy and implementation. And also through, for example, the the country leadership program to increase leadership skills, especially which are related to digitization. The use for this, or the need for this, is to provide case studies and training for national health sector leaders to increase and understand the skills which are necessary to provide digital health interventions. More importantly, this also need to map and identify weaknesses in the current data capture and reporting systems so that we can be able to address issues like regular supportive supervision, decrease data entry workload, standardized registers, and generally to ensure that we are able to have real-time data entry at the point of deliveries. Now, one of the tools which is actually in CHAD, which is actually very ripe for innovation for this particular workshop, is a tool called the Swiss TPH SysRev2. And this is one of the tools that through talking to the stakeholders was identified as one which can be scaled. It uses a clinical decision support system to provide up-to-date information for health professionals. It also supports clinical and therapeutic decision-making, and it's being used to increase quality of care, especially to the refugee population in Chad. It's currently implemented in some of the regions in Chad and has proved its efficiency. And even more regions are actually being planned for extension. Some NGOs have planned this tool for use in mental health, and GFF is going to support this. So what are the next steps? Finalize the digital health strategy and the costed long-term plan. Develop associated policies to align and govern that can align and govern approach to digital health strategy and implementation, and increase leadership skills related to digitization, so that when innovations come in, they can actually be, there could be policies and strategies to help them not only align, but also to be skilled and implemented and skilled. I already talked about the weaknesses in current data capture systems. So there's need to map and improve this the existing process and skills to ensure that digital literacy and supervision and training is taken care of. And of course, just like any other country, establish a system for a unique client identification. Lastly, look at infrastructure realities in consideration when selecting and designing a tool, especially the one I'm talking about here, the one for SysRev, and procure hardware and training for facilities. Thank you.
Excellent. Thank you very much, Daniel. This is also very interesting innovation. Je vais switcher en français. Merci beaucoup à tous. Je vois qu'il y a quelques questions dans le chat. Je regarde.
Thank you very much. I see a few questions in the chat. So I'm going to ask a first question for Rwanda. There was a question for Tanzania. So let's start with Tanzania. Is everyone here? Dr. Mariam, are you here? The question for Tanzania is the following. Do we need specific guidelines and frameworks to validate the results of innovations in Tanzania? Why not use the guidelines and frameworks that exist in other countries? Does Tanzania have any experience on that? Dr. Mariam, are you here to give us your point of view on frameworks and guidelines with regards to innovation? Mariam?
Non? Écoutez, on va voir qu'il y a peut-être un problème technique.
No,
Par contre, il y avait des questions.
perhaps there have been some technical issues, but let's ask a question for Rwanda. If I understand, for Rwanda, there was a first question on how were you able to align partners? What did you do concretely? There was also a question about sustainability if leadership changes. So Alain Placide, if you would like to respond to these two questions with regards to leadership and partner alignment.
Thank you so much, Pascal and colleagues. Basically, in terms of the alignment with partners, we have those different national platforms. Specifically, we have the subcluster platform, where we have a number of social cluster institutions, the government institutions, and also the partners, DPs, and the implementing partners. They meet on quarterly basis. We have a technical working group for nutrition, and we also have technical working group for ECD and child protection. These meets on quarterly basis. So for us, we use this platform, but we also have some ad hoc meetings so that we can fully discuss the result framework and also how data can be generated. We can create tools that can allow us to collect and avail data for that can be accessed at national level. This is in terms of the platforms, and this is really endorsed by both the government, because like for nutrition, this is chaired by the USAID and co-chaired by the National Child Development Agency. You can see how the partnership is. And we also have the ECD and child protection technical working group. This is chaired by UNICEF and co-chaired by the National Child Development Agency. So this again allow us to, the meetings are invited by both the chair and co-chair, so then they can link each other. For the sustainability in terms of when the leadership, so maybe I will have a question to know exactly a leadership at the institutional level, because this is a multi-sectoral thing. Of course, it is owned and led at the NCDA, the National Child Development Agency, but the plan is again monitored at the higher level, where even the Ministry of Finance comes in. We used to have the budget nutrition budget tagging thing, where the resource allocation, all those support this initiative to have data for the planning and decision, and also this resource allocation. So it is something that is not, it is an initiative that is really supported by a number of agencies and the institutions, ministries, I mean. So even, so it is, can say it is not something individual, it is not dependent to someone who is currently on the leadership level. It is an institutional level thing.
Excellent.
If I can, yeah.
Thank you. There are two more comments. There one who said the Burkina Faso would be very interesting in meeting because they have a similar project. So that's a good outcome maybe of this work in this webinar if two countries can connect. But there's also a question about DHIS2 and the question that about interoperability with other platforms. How have you been able to do this with this system? Not being too technical, of course.
Yeah, thank you so much. Yeah, we have the dashboard, the tableau de bord is we use the DHIS2 as an open source, a system that really user friendly, that it really IT skills for users and even the administration. And then we have, this was connected to Tableau as a software for the public page. So at least Tableau is analytics and visualization tool that can make it really easier to produce any data object. For the interoperability, of course, yeah, when from the design of the innovation, we thought of a system, a tool, a platform, technology that can really speak with the existing systems. We looked around different institutions and see which really platform can be used so that it can easily be connected to the existing systems. So that is when we came up with the DHIS2 technology.
Thank you very much.
Then the other thing, so yeah, it's a matter of consultation and the involvement of all stakeholders so that people can buy in the idea. But this is really supported at the higher level. The success was really ensured, and it is still the sustainability itself, given the effort being, I told you about it, the government, at the level of government, the commitment. So this is a government commitment, so the endorsement is there and there is a support. Thank you.
Très bien. Une petite question très rapide.
Pascal.
Oui, Daniel, yes.
Yeah, just add something on the interoperability because it's not a question for Rwanda only. I think it's important for our participants and especially here to know that DHIS2 uses something called Open API, allows it very easily to interoperate with many other systems. It's very easy to interoperate with many other systems. And just as we were working on Rwanda, we also came to realize that there's going to be a new version of DHIS2, which will make interoperability very easy. It's going to be released very soon. So people should keep tab with that. Thank you.
Thank you. Very important issue. It's a question that is quite regular in the different discussions. Une toute petite question très rapide pour le Rwanda. Jusqu'à quel niveau est décentralisé le tableau de bord?
Another question for Rwanda. To what level is the dashboard decentralized? Is it at provincial level, district level?
For data collection, it goes up to the lowest level of the Rwanda organization unit. It goes up to the cell level. Perfect. And it also goes to the health facility level. But for data visualization, it goes up to the district level. In Rwanda, we have the national level, province, and district, and then sub-district levels. But for us, for the visualization and data analytics, it goes up to the district. Well, data collection is lowest down there.
Yeah. Merci beaucoup. On a 2 ou 3 minutes avant une forme de conclusion. Il y a Jean-Bernard Bangou qui voulait...
Thank you very much. And now for conclusions, we have Jean-Bernard Bangou. He would like to talk about the Chad project. Jean-Bernard, would you like to take the floor? Yes. Thank you very much. Thank you for giving me the floor.
Thank you. I wanted to thank Daniel for his wonderful presentation. And I also wanted to add some elements to elaborate a little bit more. We have to say that there was a conference, a national conference regarding digital health in June 2022. And during this conference, there were some innovations that were presented in Chad, in particular DHIS2 that was launched by the PADS in the area that it intervened, thanks to Swiss cooperation. And there was some work that was done with the Ministry of Health, and then it was adopted at the national level. But the actual use of this particular tool in all of the provinces in the country is not, it's still not completely a reality. But in the areas where we actually work, in the two areas where we actually work, Bata and Waishari, this particular tool is efficient. And so the data are analyzed, they are sent with thanks to this mechanism. So this is actually a really good gain. And with the support of the WHO with the other provinces, I think that this is underway. And with time, I'm sure that we'll be able to get to a good level for using this software. In the presentation, it was also said that the CISREF, the system to support refugee care, was implemented by SUSTPH and CCC in the Gore area. And this project was developed tools to help with clinical decision. And with using tablets, the people who take care of them are actually have treatments, and there are some algorithms that were developed for this. And so we already have some very good results from the users that are the people who are taking care of these people, but also from the patients. So there was an evaluation, a recent evaluation of this particular tool, and they're very, very happy. So the other aspect is this development of electronic registry. And we are talking with the Ministry of Health to have an extension and to basically for it to be used everywhere. So the last tool that we are developing for the health insurance is the Open HIMIS tool, which is a information and management of health data that is implemented right now and that is being developed in the areas where we work, in particular in Dalamaji, where we actually have a health facility. And with the Ministry of Health and with PADS, we are in the process of developing this particular tool and see in the UHS, Universal Health Coverage, how we can actually use it for the UHC. So these are some more elements that I wanted to actually add to the chat presentation. Thank you very much. It was really good to have added all of this. Dr. Miriam.
Can you speak? We just wanted to I wanted to ask you a last question before we go to the close. No? The mic doesn't work? Okay, too bad. Too bad. Anyway, I had a last question. Maybe je vais passer en français.
I'm going to go into French. I have one last question, very, very quick question for Rwanda and Chad. A question about what advice could you give countries based on your experiences for countries that wanted to actually undertake a process of innovation? Alain Placide, if you want to start, do you have one advice to give countries who want to actually launch this type of project? Alain Placide? One advice, only one.
Thank you so much. Thank you so much, Pascal. Simply, there is really what I can say on this project. There is a need for any information system development. There is a need to be clear in terms of requirement gathering.
Sorry, Alain, your mic is off. I don't know.
Yeah,
Okay.
yeah, thank you so much. I was saying, thank you, Pascal. I was saying there is a need to make sure that requirement gathering is ensured, maximum of requirement specification.
Okay.
In addition, there is that stakeholder involvement from the start up to the process, the journey, the entire journey to the completion of the project.
Okay.
And also the buy-in. The last one is the buy-in, to ensure the buy-in of the leadership. Thank you.
Yeah, you mentioned it in your presentation. Indeed, you mentioned that as an essential element. I don't know, Jean-Bernard, would you like to share a last comment on how would you recommend for other countries who want to, what piece of advice would you like to share for those who want to embark in these issues? I don't know if you want to go, Jean-Bernard, or maybe Morbe, someone for Chad, or Daniel.
Oui,
une recommandation, Jean-Bernard?
Pour moi,
for me, the last point that I wanted to mention is to have a involvement of all the stakeholders for this initiative, to actually do a feasibility study like we have done in the places where we work, to have a pilot phase. And so the pilot phase will allow to get some results, and then you can actually go into an extension phase. Thank you very much to all of you. Thank you very much to the representative of Chad, Tanzania, and Rwanda. It was really a pleasure to listen to you. The next step is to wonder what is the plan for innovation, GFF innovation, and I will give the floor to Amir, who is responsible for the operations team in the GFF. Amir, you have the floor.
Thank you, Pascal. Great facilitation. And thanks so much for all colleagues, especially from countries, for sharing your experience, success story, challenges. And we're very happy to continue this discussion. And as 2 hours is not enough to really go to deep dive, but this is just to show the high level engagements of countries and also GFF. I'll be very brief. I'll mention that 2 areas of focus areas that GFF will want to continue working with countries, government, and the stakeholders at a country level. As you can saw from Siniha's presentation about different stages of innovation and GFF engagement, from early stage, from the transition stage, and mature level of engagement, we are planning to continue support countries to really systematically identify innovation that was identified during the challenges or to solve the needs of the countries and already tested and prove that they can really, solve the challenges or the problem that was identified by the countries through a consultation with the stakeholders and reach at mature stage. One thing that we identified during a discussion for the last few years with governments, donors, and civil society and other stakeholders is the challenge that the countries are facing after they identify the innovation, after they piloted, after they tested. It's very difficult to scale up at the national level due to different reasons, due to technical support, due to finance, due to the space that to get to do more at national level is a major challenge. So we want to focus from next year and the year after, we want to focus to work with you very closely with the countries to identify those piloted and tested innovations that reach at mature stage that can be ready to scale up at national level to solve more problems, to address more challenges of women, children, and adolescents. And we want to help you systematically by incorporating those mature innovation to the investment case, and also to help you to how to identify those innovations systematically, because I know at the country level, there are multiple innovation pilots at different levels. Sometimes it's very difficult to track them and to know which one is working and which is not. So we're very happy to help on that. and also to help to mobilize some resources, as we always do, as part of investment case. So special focus on innovation on RMN CHN. And we're also very happy to see the possibility of identifying bank projects to co-finance those innovation to scale up. So that will be one of the major focus area for GFF to support countries. And second is also, as you heard from Supriya, about systemic approach to see innovation at the national level to make sure that we are addressing the nation. That's including service design, service system designing. And that's something that we want to continue to work on, the systemic design of resource, how we can redesign the services to seeing those approach from quality and equity lenses. And we're very happy also to explore different opportunity at different level, how we can support on to redesign systematically to improve quality of services and how we can play innovation on this. So these are the two major focus areas that we want to focus, but we are very happy to continue this discussion and collaborate more with all of you. Thank you. Over to you, Pascal.
Thank you very much. So we're coming to a close. Are there last comments before we close? Is there anything else?
Maybe Pascal can add one thing.
Please go ahead.
If you can also mention about the role of KNL. Luis, thank you, Luis. Also, you are also sorry that not to put you on spot, but just so we can also play a role on as knowledge and learning to identify cases, just like we are doing right now, and to share across countries, and also to really show that what's working and what's not working, so that other countries can learn. So we have a relatively good big KNLA team at the GFF that focus on sharing this information and ideas and also working. So maybe Luis, Pascal, you can also give some comment about that.
That's a very good point, because I realized that I didn't introduce myself when we started, and now I realize that. So that's the end. So just to tell you that my name is Pascal, as you've seen, and I'm part of the knowledge and learning team of the GFF. And one of the things we do is to design and support our experts in the GFF and our countries to showcase their work, but also to support in countries or via any means the learning that we can draw from experiences in countries or for technical expertise. So yes, that's what I could add. And my colleague Fernanda that you saw in the beginning has been the one facilitating this process for this, coordinating the different presentations, etc. Luis, is there anything you'd like to add about the role of the knowledge and learning team? Is there anything on the spot?
Thank you very much, Pascal. No, not much. I think Amir and yourself said most. So my name is Luis Pinto, and I lead the knowledge and learning team at the GFF. I think the essential has been said already in terms of the importance of sharing cross-country learning and cases being of success, but as well challenges that countries face, and that it's important to share with others and get insights from one another. This arena of innovations is just one of them. I've been very glad to work with Amir and Snare and Daniel and many others behind. And just a big thank you to Fernand and Pascal for making this event happen in the way it did. Thank you very much for all of you for your engagement. Thank you.
Thank you very much. Yes, it's really important, as Fernanda says, that it's a place for learning, and it's not just to listen to things, but really we find ways to communicate what is behind the processes and not just the results. That's why we take time to go through the whole process of the innovation and to realize that there are challenges to learn from everyone. I see some comments in the chat, and I'm really blushing, in particular because of the comment from someone called Jaime del Olivero. I'm really blushing, and thank you, Nadine. Alors, that's the end, and we will have more conversation on this topic. You know that our colleagues Sneha, Supriya, Amir, and others in your countries, Daniel, are here to support you in these issues. If you have any need, don't hesitate to contact them. In your countries, the focal points also have play this role of connecting on these issues. So that's all I'm gonna say, and I'm laughing because there are some comments in the chat. So I'm gonna say thank you to Dr. Mariam, thank you to Alain Placide, and thank you to Daniel and Jean-Bernard for their contribution. Merci beaucoup à tous. Merci beaucoup à toutes d'avoir participé. C'était un bon groupe, un grand groupe.
Thank you very much to have participated. It was a great group. I hope that I will see you again. I invite you to turn on all of your cameras to say goodbye to each other one last time so we can all see each other. Dr. Oscar, how are you doing? So thank you very much to all. It's always a pleasure to see each other. We're a little far away, but with the camera, it's really good. And Serge, you're on the phone, but we can still see you. So thank you very much. Thank you very much. Have a good morning, afternoon,
Thank you,
evening.
everyone. Thank you. Bye.
Thank you. Thank you very much. Bye-bye.
Thank you.
Bye-bye.
Bye.
Longue vie à l'Afrique.
Merci.
Bye, bye. Thank you,
Au revoir tout le monde.
Pascal.
Merci.
Thank you very much.
Merci, Daniel. Thank you very much. Thank you. I'm blushing. Je rougis. Thank you.
Allez, bye bye, merci.
Bye tout le monde. À bientôt. Au revoir.
Bye.